Once again, welcome to you, Natalie. Thank you for joining us. Natalie was on the Channel 9 show Paramedics. I know a lot of people probably would have watched that show. She's also obviously a full-time paramedic. And I think right now the work of paramedics has always been crucially important, as we know. Every minute is a precious minute in their lives and their work. I actually wrote an article. I should have sent it to you. I wrote an article in last week's Jewish News or 2 weeks ago on paramedics and on first responders. I'll forward it to you. Yeah.
Please.
So I think right now, with COVID-19, I think people in the in the first responder world, where there was the bushfires and COVID-19, nurses and paramedics, people are really starting to appreciate the challenges of your line of work and the sacrifice. And as I said in the article, and I'm sure you would probably acknowledge this, I think most of people in your industry want to say, well, it's just our job. We don't deserve any praise. We just get on with the job. But I think we do want to give you praise and we do want to thank you. And so thank you once again. And as I said, please, if you have any questions, we'll address them at the end of Natalie's talk and we'll just have a bit of a discussion afterwards as well. So thank you everyone for joining us. It's lovely to see such a nice turnout that's come to here. And I guess it's a testament to the interest and hopefully the respect that people should have for the people in your line of work and the incredible things that you do to keep us safe and to saving lives in the real sense every single day of your life. So welcome, and I'll hand over to you.
Well, firstly, thank you, Rabbi Daniel, for inviting me to talk tonight, and thank you to everyone that's tuned in to listen. Yeah, we all had busy nights, and you've all obviously given up your free time to come and hear me. So I just want to thank everyone for doing that. And yeah, it definitely has been an interesting time over the past 6 months working during a pandemic and during COVID-19. So I'll definitely get to that, but I'll start. I'll give you a bit of a background about myself and my journey and my progression with Ambulance Victoria. So, one of the questions I'm often asked is why did you want to be a paramedic? People always are fascinated. What drew you to that? And the truth is, it's not that I chose to do it. It really was my calling in life. I remember as a child being, for some reason, fascinated by ambulances, whereas other girls were playing with dolls. I just wanted to be in an ambulance and I wanted to know what they were doing, and the thought of being first on scene and being able to make a real difference in someone's time of need really appealed to me. And I have this distinct memory of as a child, we were driving along Dandenong Road, which everyone knows well, and I think my mum was driving and I was in the back of the car, and there was an ambulance parked on the side of the road with the beacons, with the lights flashing. And I remember looking at it and saying to myself then and there, one day you're going to be in the back and you're going to know what they're doing and you're going to make a difference. And so it was a natural progression for me. And I think everything I did in my life was working towards becoming a paramedic. So it's been a passion of mine. It doesn't feel like a job. I don't feel like I'm going to work. I really feel like I get up in the morning and I get to do my passion every time I go to work. So I feel very fortunate and privileged to have found something that drives me. So that's great. So I've now been a paramedic for just over 17 years with what's now Ambulance Victoria. It was then called Metropolitan Ambulance Service back in 2003 when I started, and I worked for about 4.5 years full-time before falling pregnant with my first child. So I was full-time 4.5 years, and for the past 13 or so years I've been part-time. I've had 3 years off having my 3 children, but I've always worked in between, and so for me, it's part-time, so it works out to be about 27 hours a week. It's either 2 or 3 shifts a week, and they vary between 10, 12 and 14-hour shifts, so they're very long. And we say they're a 10-hour shift, but often the 10-hour becomes 11 hours or 12 hours, and so I'm often gone 6 a.m. till 6 p.m. in the evening. So they're long days, but it works well. I'd rather do 2 or 3 long shifts rather than 5 shorter shifts throughout the week. And it's a combination of predominantly days and afternoons and the occasional nights, which I try and avoid, but it is part of the work that we do. So, so that's my roster. I was very fortunate that when I started with the Metropolitan Ambulance Service, we were actually employed as employees and paid to train. So it was like an apprenticeship almost. So I started and I had an instructor with me, and 80% of my training was on the road with an instructor or a senior paramedic, and about 20% of it was at university. And after 3 years, I qualified with a diploma in ambulance paramedic studies. That was back in 2003, and I was very lucky because I was paid from day one. That's now changed, and I think it would have been around maybe 2005, 2006, it became a university degree. So a 3-year undergraduate degree. So every year there are hundreds or thousands of students that complete the degree at various universities and hope to get a job with Ambulance Victoria. And I guess the problem, whereas I was employed, the issue now is that you have a lot more students doing the course than there are jobs available. So, and because there's only one ambulance service in Victoria, it's a very competitive environment. So you're not necessarily guaranteed a job with Ambulance Victoria at the end of the 3 years. And so there are options with interstate or overseas or non-emergency services whilst waiting to get a job here in Melbourne. So I didn't come out with the degree, and the students that do the 3-year degree now have their clinical knowledge is far greater than what I had in that I achieved in my diploma. But I've got 17 years of experience behind me, so I can walk into a house and look at a patient and know fairly soon whether they're sick or not and whether we need to move quickly or not. Whereas students coming out today, they sit at uni for 3 years and then they come out for a year with an instructor before they qualify, but they don't have that experience behind them to make those decisions. And a lot has changed since I started. There's been huge changes in the service. So firstly, we're one service, so we're Ambulance Victoria, which is a Victoria-wide service. When I started, there was Metropolitan Ambulance Service and Rural Ambulance Victoria. So two separate services with different protocols and policies, whereas now it's all streamlined and it's one ambulance service. So things that have changed and the big one is our guidelines. So when I started, we had a small book with a number of guidelines, and it was very black and white. Over the 17 years, that little book has turned into an encyclopedia, really. And now, whereas we were expected to remember all the guidelines and all the medications we use, Ambulance Victoria is aware that we just can't retain all that information all the time. So we now have access to a phone app, which we're encouraged to use the phone and refer to the app and refer to the guidelines so as not to make mistakes. When I look at hospitals and the way they operate, and they have whiteboards and everyone's double checking and they write things down and they say things out loud. When I started, you're expected to know it all, and it all had to be up here. Whereas now they don't have that same expectation. So we have far more guidelines than we did when I started. And with that comes more skills and more drugs or medications available to us. So there's a lot more options now, and it's not as black and white. We have guidelines, but there are some grey areas. And for example, when I started, the only type of pain relief that we could administer intravenously was morphine. Now we have fentanyl or morphine. So we have to make an informed decision. Which drug are we going to use? We need to consider the side effects, any adverse effects of the drug, and determine which one are we going to use. So we have to use our knowledge to make informed decisions, as opposed to being told, here's one drug, use it. So with the change to the uni degree comes a lot more, I think, responsibility to make good, accurate clinical decisions, as opposed to being told what to do all the time. So yeah, we have more drugs available. For example, we can now sedate, and we're encouraged to sedate agitated patients. So I remember many a times transporting very agitated patients due to either mental health problems or drug or alcohol intoxication or combinations. And we would transport these patients to hospital being held down by police officers in the back of the ambulance, and that was just expected of us. Whereas now there's a real push to look after our physical, mental, psychological well-being, and now we're provided with medications to sedate patients so that we can transport them safely to hospital. Another big change is that we have designated manual handling vehicles. So I remember when I started, we lifted everyone. We carried and we lifted and we schlepped. And I remember carrying someone on a wheelchair down 3 flights of stairs because he was having a heart attack. So we were taught, you lift patients off the ground, no one walks. And now it's the complete opposite direction. So we don't have a no lift policy because there are times, for example, with an unconscious patient that we will need to lift them, but we have manual handling vehicles available to us to help with difficult extrications of patients. We have lifting machines and slide sheets and multiple devices that ensure that we don't hurt ourselves doing our job, which is a big change. So it does mean that sometimes we do have to sit on scene for longer with an unwell patient, but at the end of the day, if I hurt my back by lifting someone that I shouldn't be, then I'm out of a job and I'm no use then to that patient anymore or to anyone else. So we do need to prioritise our safety. Obviously, we have to manage the patient well, but now we have lots of other options to move them. Also, a recent introduction, I think it was about 2 years ago, is we introduced a mobile stroke unit, which is based out of the Royal Melbourne Hospital. So it's a designated ambulance that is dispatched to patients having a stroke. And the beauty of that is that they can actually scan the patient on scene. So they have a mobile CAT scan in the back of their ambulance and they will scan the patient and they can actually administer treatment and clot busting drugs on scene. And so as to start the ball rolling and start managing that patient on scene as opposed to transporting them and waiting for a scanner to become available at the hospital. So it's been really good feedback with that stroke service and really good outcomes with patients having strokes. Some other changes is that when I started, everyone was in an ambulance. It was all a 2-person crew. And I'm what they call an ALS paramedic, so advanced life support. And then we have our MICA ambulances, which are mobile intensive care ambulances. And they also were a 2-person crew. They've moved away from that layout because they realised that for a lot of jobs, you don't need 2 intensive care paramedics. For the critically unwell patients that are dying, then yes, they'll always send 2. But for most jobs, 2 paramedics such as myself, such as advanced life support, can work well with 1 MICA paramedic, and they've realised that that's an appropriate team to provide. So they've moved from 2-person to a 1-person operator in the MICA units. We also have motorbike, the motorbike response team. So beauty about them is they can get through traffic. I mean, there's not much traffic on the road at the moment, but usually when there's a lot of cars and it's peak hour, the motorbike can get to jobs a lot quicker than we can. Another big change is that we now have a referral service. So a lot of people call ambulances for a variety of reasons, and dispatching an emergency vehicle is not always the most appropriate option for them. So we have a referral service that can look at other options such as sending a locum out, sending a nurse specialist out, a non-emergency transport service if the patient needs to be transported to hospital. So they have really helped reduce our workload in terms of attending what we call non-emergency jobs. and finding better options for the patient, which also then frees up ambulances and also hospital beds and wards. So it's got a flow-on effect. So that's been invaluable and a big change. So there's been lots of things that have changed over the 17 years. One thing that stayed the same is the types of jobs. So we go to the same types of jobs that we did when I started, and yeah, that's been consistent throughout. And it does depend on the day and the area, and whether it's daytime or evening time or weekends, as opposed to weekdays. We do see different types of jobs, but the jobs are the same. And I must say, I still, 17 years in, enjoy it just as much now as I did when I started.
Lots of questions coming in though.
Oh, really? Do you want me to keep talking for a bit?
Yeah,
or
it's a bit more, but it's amazing how many so many questions.
Yeah, always. I'll just talk. I'll talk a little bit about. So, as you mentioned before, I did this TV show called Paramedic. So 2 years ago, a production team pitched a show to Channel 9, which was to follow around specific ambulance crews and monitor what we do and follow what we do and follow our story. And by then, I'd been in the job about 15 years and was really looking to do something different. And so I filled in the application form and sent it in, not knowing whether I'd hear back. And I was contacted by the media team that said, "Oh, your application was successful, so you moved through to round 2, and so the next step will be a Skype interview with the production team." And I had my interview and I was a bit nervous, and they said to me, "Well, why do you think you'd be good for the show? You know, what gives you an edge over everyone else?" And I remember saying to them, "Well, I'm an almost 40-year-old divorced Jewish mother of 3, you know, looking for love." And he pretty much, you know, without saying it, pretty much went, "Yeah, you're in, you know, where there's not many people out there like you. So you kind of tick all the boxes for what we're looking for." So that's how I ended up being on the TV show Paramedics. And I think for me, one of the main reasons I did it was my kids would often say, you know, "Mum, what did you do at work? And tell us a story, and what happened, and what did you see?" And I don't have the kind of job that they can ever come along and spend the day with me. You know, they'll never really be able to get to see what I do. And so I thought, this is the perfect opportunity for them to see what I do every single day. And so when we eventually sat down and watched all the episodes, it was amazing, because it opened up, you know, all these questions and discussions that we had, and the things that shocked them were different to the things that shocked me, and the questions they had were not what I expected from them. But it was great because they really got a first-hand experience of what I do. You know, now they're completely over it. Now when it's on TV, they're like, "Yeah, Mum, whatever. Like, we've seen it, you know, you're just Mum to us." So my eldest, who just turned 13, I'll be like, "Oh, Bella, you know, do you want to watch, I'm on the TV show tonight." And she's like, "Mum, I've got to wash my hair." So she's totally lost interest in it. But it was great. It was really good. And I had a really fantastic experience filming the show. And I had a wonderful on-screen partner who I didn't know before, but they paired us up together, and it was a really good match. We got on really well and we worked well together. And so it was a really fantastic experience, and they hope for it to be an ongoing show, hopefully. You know, which brings us to now and COVID, and we're not currently filming because of COVID and working through a pandemic. And I must say that, you know, the last 6 months has been really extremely challenging working during a pandemic, and it's changed the job hugely, even from the moment that we arrive. So whenever I get to a patient's house, we walk in, we introduce ourselves, and the first question we ask is, you know, "Why have you called an ambulance today?" Because sometimes the information we receive is not always 100% accurate, and maybe they've called for something different. So that's normally the first question. Whereas now, we don't even enter someone's home. We stop at the door, and the first questions we ask are, do you or anyone in the house have a fever, a cough, a cold, shortness of breath, sore throat, or have you come into contact with anyone that's COVID positive? Like, that's the first thing we ask now, which is hard because people call in an ambulance, usually in a time of need, it's an emergency. And so to then be confronted with those questions immediately is, I can imagine, a bit unsettling for a patient. But that's, you know, that's the expectation now, is that we don't enter until we've asked all those questions. And once we've deemed it safe to enter, we enter the house. We're still treating the same types of patients, but we've definitely had to modify our approach and management of the patient. So we're trying to minimize contact and unnecessary exposure. For example, I've always auscultated or listened to patients' chests. Like, that's always been part of our assessment criteria, is listen to someone's chest. Whereas now we've moved away from doing that unless it's absolutely necessary, so as to minimize contact or potential exposure. If someone is short of breath, we will always listen to their chest. However, if they're not, we might remove that assessment tool as it's deemed unnecessary. The job has become very labour intensive. We're not only focused on worrying about what's wrong with the patient, but also, does the patient potentially have COVID? And that's always in the back of your mind. You know, am I walking into someone's home where they've potentially got COVID? Am I going to be exposed to it? And so the job has become quite, it's physically draining in that we're cleaning and decontaminating and donning full PPE from head to toe and changing that and changing uniform. And there's a lot more cleaning. We joke now that, you know, the ambulances have never been this clean because all we do is clean. And when I say clean, we literally clean from the ceiling to the floor. We wipe down all the cupboards, every handle, every button, every knob, the stretcher, all the equipment, the floor, and we're decontaminating everything. So it's become very labour intensive to do that after all jobs. So that's, yeah, I mean, that's changed. And we're wearing PPE, so goggles, masks, face shields, gowns, plastic gowns or overalls. And we're not used to working in that kind of environment. So that's really changed things as well. They're uncomfortable and hot. And there's talk about how we're going to manage that during summer, because you get very hot and you sweat. And once you put on your PPE, it cannot come off until you have offloaded the patient to hospital and then decontaminated yourself and cleaned the ambulance. So you know that you're in it for at least 2+ hours. So they're looking at what's going to happen over the summer to prevent us overheating. I have been into people's homes where there have been confirmed COVID cases. So yeah, it's like walking into the lion's den. You know, you're told what you're going into, but still there's always that fear at the back of your mind. You know, what if I am exposed to this virus? And then I know at the end of the day, I'm going home to 3 children. And what if it's on me? And what if I inadvertently take it home? So there's always that worry. And that's on top of managing the patient. So you've always got that running in the back of your mind, even when you're trying to manage critically unwell patients. I think another big thing that's been very hard working during the pandemic is the lack of physical touch. So we can't comfort people the way we used to. We can't comfort colleagues the way we used to. I recently went to a traumatic job where someone had actually, they'd committed suicide and ended their life. And it was a very traumatic, confronting scene. And the person I was working with was very distressed at the end of it. And I said to him, all I want to do is give you a hug. Like, I just want to hug you. And I can't. And we're both standing there in full PPE, you know, thinking, what's happened that I can't touch you and I can't comfort you, and you can't to me, and you can't comfort patients very well, and you can't comfort family members. We're not allowed to currently transport family members in the ambulance unless the patient is deemed to be end of life. So otherwise, or it's a minor. So we're always allowed to take a parent with a child, but if it's someone that's critically unwell or is unable to speak for themselves, we can take a family member or a carer, but otherwise no family members are allowed. So there's also, the patient doesn't have the comfort of someone around them. So the whole environment has really changed, and it's, I think for me, taken away a little bit of the passion I feel for the job. I go to work and I go, okay, here we go, let's see what we're going to go to, and let's hope we're not exposed to COVID, and how many times are we going to have to clean the ambulance today, and all these things that we've never had to worry about are now a daily part of the job. So it's definitely changed how we operate, but the whole world is going through it, and I'm just, one tiny part of it. So that brings us kind of up to date now. I hope that's been okay.
Oh, wonderful. I mean, there's so many questions that are born out of your talk, and from so many different angles, from your own personal story to the show to COVID. So I'm just going to take them, some questions that have been sent, and we'll go through them one by one,
please.
Okay, and we'll see how the conversation leads. But let's just sort of go back to the beginning. Just I know we're sort of in the thick of COVID, so I don't want to maybe sort of dwell on that. But let's just go back. You mentioned about the qualifications that paramedics are getting today.
Yes.
Would you have any idea if those qualifications are acceptable in other states and overseas?
Yes, they definitely are, because there are some paramedics that haven't been employed in Victoria and they have chosen to go interstate. I know London, currently because of COVID, I think things have probably changed a little bit, but a lot of students that finish the degree choose to go to London to start their career over there for a couple of years and then come back here, or interstate. So yes, it's very common too. Maybe there's a little bit of extra learning. I'm sure there are some guidelines that differ from state to state.
Yep.
And drugs that we use, same with overseas, but you definitely can apply for jobs elsewhere.
Yeah, okay, very good.
Yeah.
So a couple of things. As I said, we'll get to COVID shortly.
Sure.
But you mentioned something which I think would be a lot of people would be curious about, and you did touch upon it when you mentioned about comforting your colleague.
Yeah.
What would you say? You've done this for 17 years. What and you don't have to necessarily get gory, or what shocks you? What surprises you? Anything, or do you sort of just switch gears in your mind and you're now on the job?
It's a really good question. For high pressure jobs, I kind of go into autopilot. So at the time, I'm focused on what do I need to do clinically to manage this patient and get them to hospital alive. I don't have time to think about, I guess, everything else that's going on. I've got a job to do. And I think it's beneficial because, as I said, I recently went to a suicide, and I looked at my partner and I could see his hands were trembling, and the adrenaline's pumping, and you've got a difficult scene and you're managing someone. And I surprisingly felt calm, which I think is an asset. I think I was able to kind of control my emotions and do my job. So when I'm doing the job, it's okay. I feel calm and under control. It's after we drop the patient off at hospital that we then get to stop and really think about what we've just witnessed and what we've just seen. And often it's not just the patient that we're managing, but it's family, it's bystanders, it's strangers, it's friends, it's whoever else has been exposed to that scene. And definitely when someone dies on scene, they no longer become the patient, but it's the family members or friends that are then become patients as well. So we have to think about managing them. But going back to your question, what shocks me, I think when I started the job, I was only 23 and I was quite sheltered. You know, I grew up in Caulfield and went to a private school and kind of lived in this bubble world. And for me, the thing that shocked me most was how people lived. I was really taken aback by the state of people's homes, of them, of their kids, of the environment they live in. And it came back to when I was on the TV show. I remember my children were watching, and there was an episode where there was a intoxicated man sitting in his room surrounded by rubbish. And the question my kids wanted to know was, why is there rubbish all around him? So that was what struck them as being unusual. And I remember feeling the same way. I'd walk into people's homes and think, how can you live like this? Or there would be animal feces all over the ground, or insects, or rotting food, or hoarders that had piles of rubbish, and you had to, you know, follow the little pathway between the mountains of rubbish to get to people. So that for me was a real eye-opener. We don't get to walk into people, you know, strangers' homes all the time, and all of a sudden I was doing that on a daily basis. So that shocked me. That was the big eye-opener.
Very interesting. Yeah, wow. It would be like, because you and I guess you don't know what you're walking into.
That's right. You never know. And part of the job that appeals is the unknown, but that same part of it also scares me sometimes, because you just don't know what you're walking into, what you're going to see, what you're going to be confronted with. And that can cause anxiety as well.
Yeah. So I know I work I'm a Victoria Police chaplain.
Yes.
I work with the police, and I know Victoria Police has done a lot of work with, you know, trying to look after the mental health of police officers.
Yes.
What sort of resources does Ambulance Victoria offer you, you know, to debrief, to deal with your anxiety and so on?
Yeah, so we have a peer support program where we have access to peers 24/7. So if we go to a particularly traumatic or confronting job, the peer support program is notified, and usually that evening or the next morning they will give you a call and check in and see how you're doing. We also have free psychology service available to us that we can access whenever we want. And I have used that service in the past. I've made an appointment to go speak to the psychologist. And then they have psychologists that come around to the branches. It's called the SMART program, and they book in with a certain branch. And if you work at that branch, then you can choose to speak to the psychologist, make a time and speak to the psychologist. So we have lots of options available. If we need to leave a shift early, if we need to be taken out of service for a couple of hours because of something we've been exposed to, if we need to take mental health days, all of that is available to us. So real push to look after our mental health. They're well aware that, I mean, there's an increased risk of depression, anxiety, and suicide amongst shift workers, and particularly those in the emergency services. So Ambulance Victoria are well aware of that and really do everything in their power to make sure that we're well looked after, both physically and especially mentally.
Wow, very, very, yeah, I think it's so crucial. And like you said, you know, even if you've been on the job for a long time, you never know what could strike next. And therefore you've got to have those resources if you do feel like something's impacted you.
Definitely. I still go to jobs that I haven't been to before. So I've been to most jobs, but every now and then they'll throw something at me that I didn't expect or that I've never seen before. And the expectation is that you need to manage those jobs. And sometimes it can be terrifying. So to debrief after, and they really encourage you to speak to your colleagues. So I think part of the issue with my job is that you don't necessarily want to then come home and unload onto your partner what's happened today, because you don't want to expose them to something that's been traumatic for you. So sometimes I have to think, well, who can I talk to about this? A friend or family member? And then sometimes I think, well, it's better that I speak to my peers, you know, and I'll make the call and have a chat about a job I went to and talk it through. And I find that that's really the best form of therapy, is talking through the jobs with other colleagues.
Yeah, I think that's that's really true. I know, as a rabbi, you sometimes, obviously, there are times where you do need to seek, people outside of your zone, out of your profession, but usually debriefing with colleagues is often a very therapeutic, format. But now I'm just wondering, in terms of what you do see, do you find like when things are sort of relatable, like if you would deal with a 13-year-old, does that traumatize you more or stand out more for you?
Definitely. And especially after having children, it changed the way I approached kids and jobs with kids. So every time we get dispatched to a child, my heart starts thumping that little bit faster, because we deal, probably 95% of the work is with adults, and I can manage a critically unwell adult easily, but we're not often exposed to kids that are very unwell. So it definitely gets to me a little bit more. Definitely. And things like delivering babies or attending women in labor, I can totally relate to what they're going through now. So that changes my approach as well. And things that it's helped me being a mother. So I can walk into a job where there's a child and I can look at them and I can look for whether they're alert and whether they're crying. And we always say, a baby crying is the best sound ever, because we know that they're breathing. So that's always a good sign. So definitely my personal experience has changed the way I approach things, for sure.
Yeah, very interesting. Now, obviously you work hand in hand, or you need to work hand in hand with police.
Yes,
but,
very much so.
I mean, how often have you felt vulnerable in terms of your own, and I don't mean like from the COVID, but I mean like you're dealing with drugs, you're dealing with alcohol, you're dealing with violent people.
Yeah.
Do you ever feel like I just want to get out of here?
All the time. Definitely. There's a big push for us not to enter a home if we don't feel safe. So we do work very closely with police. And if there's any sign of danger, we don't enter, or we retreat and we wait for police. But sometimes it doesn't present itself as being a dangerous situation until we walk in. For example, we got called to a job a long time ago. I can't remember the specifics, but we rang the doorbell and he said on the buzzer, "Oh, it's too late." And we thought, "Oh, it's too late for what?" And so we approached the door, and then patient opened the door and he had a self-inflicted stab wound to his stomach. So he was implying, it's too late, I've stabbed myself already. And so the problem is, we've then got a patient that's got a knife on them, and you've got to make that decision. Well, do we go in and help him, or do we retreat? But at the end of the day, my safety comes first. Like, there's no point trying to help someone if I'm not going to then walk out of that job and go home to my family at the end of the day. So we left that scene straight away. There have been times where we have dropped our bags and run because a patient's become agitated and lunged at us, or made a dive for us. I've been hit twice in the job, both times by intoxicated patients, and I've really learned from that to keep my distance if things don't seem quite right. So by getting too close to unpredictable patients has opened me up to violence. So we learn now, keep your distance. And I've learned that through experience, unfortunately. But you just don't always know what you're walking into. And so we always enter cautiously, looking for signs of danger. I'm now very good at examining my environment. So I'm constantly looking around, where's the door? I won't let anyone lock the front door. So you got to lock the front door, I'm leaving. So, yep. And if you tell me to F off, I'm going to F off. So I'm not going to stand there and negotiate with you if you're going to swear at me and become verbally abusive. So we will leave. We then will call police and wait for them to arrive and then re-enter. But yeah. Wow.
So it's scary, very, very scary. I mean, sure, to think, and as you said, going into possibly environments where, as you said, growing up in like you mentioned, what was a sheltered upbringing, and then to see what's going on out there is is just overwhelming, probably.
I think I find it hard when I'm just doing my job and I'm being abused and sworn at and threatened and called names. And sometimes I have to say to a patient, you know, I'm being very polite to you. You've called. I'm here to help. I'm here to do my job, but you need to treat me with the respect that I deserve. I'm not a punching bag.
Yeah.
So, yeah.
And what, in terms of drugs and alcohol, how prevalent is it in what you're seeing in your specific responses that you're involved in?
Yeah, it makes up a huge percentage of the work we do. I'd say, or at least a third, if not close to half of the work we do will involve alcohol, drugs, mental health, and often the two go hand in hand. So those with mental health problems are more likely to abuse alcohol and drugs.
Yeah.
Things at the moment are different. We're seeing different types of drug use. There are no parties at the moment. So, nightclubs are closed and bars are closed. So we're not going to the types of overdoses that we would normally see in that kind of environment. But people are using drugs and alcohol in their homes a lot more. So I'm going to drug affected patients that are at home with families and kids. And I did one recently that had young kids at home, and he probably would never use drugs in that environment, but you can't use them anywhere else at the moment. And alcohol is a big problem. And now people are home and people are lonely and people are depressed and people are drinking a lot. And so we are attending a lot of very intoxicated, lonely, depressed people that fall and hurt themselves or feel suicidal and don't know who else to call. Yeah, big part of what we do.
It explains a lot of the nature of what you're doing. Here's an interesting question. Someone's asked, and I know it might be very hard to answer this question, but if you could look at sort of two ends, your most traumatic or horrible experience in your 17 years and your most rewarding, you just left that night feeling or that day feeling, this is just incredible what I've done today.
Yep.
I don't know if there's any standout moments that.
Yeah. Look, in terms of traumatic, we without going into specifics, we do go to jobs where people die and children die and people commit suicide. And so those jobs are always very traumatic. And I think there wouldn't be a paramedic out there that would say, I enjoy going to those jobs. No one joined the ambulance service hoping to go to those jobs, but they are unfortunately part of what we do. So definitely they're very traumatic, and there are some jobs, unfortunately, that will be forever ingrained in my mind. I think, look, I've delivered 3 babies on the road, which has been fantastic. So that's been wonderful. We're always very nervous delivering babies, although it's a natural process. You're dealing with a mother and a baby, and things do go wrong. And I've had some near misses, so they can be scary, but definitely a standout job for me. I don't think I'll ever forget this. I was working with a new student. He'd only been in the job a few months, and we went to a gentleman, middle age, I think, having a stroke. And when we arrived on the scene, he was conscious but non-verbal, so not talking, but he understood exactly what was happening and was able to communicate with us. And he unfortunately deteriorated in front of our eyes. So he went from being conscious to actually becoming unconscious and started having seizures and fits on the way to hospital. So he became critically unwell, and it was, we were dealing with a critically unwell patient, and those types of patients usually are having huge strokes and don't recover. And I was working with a student. I said to him at the end, unfortunately, I don't think we managed to transport the patient to hospital. I said, look, I don't think he will survive that. It's a catastrophic event. And they did a scan at hospital, and the emergency staff came to us and said, look, he's had a huge bleed. We're going to speak to the family about their wishes. So I'd assumed they would palliate him and he wouldn't survive. And then about 6 weeks later, I got a thank you letter from the man's family that said, we just wanted to update you on his progress. Not only did he survive the bleed and he stay in intensive care, but he's now been discharged from hospital and is rehabilitating at home. And I was floored, like absolutely floored. And they said, thank you for your quick actions and rapid transport to hospital. And you saved his life, basically. And I remember I called the student and I said, you're not going to believe it. The patient that I was convinced would die actually survived. And so it really stuck out in my mind. And I think what was great was that I wouldn't have known, had the family not taken the time to thank us, I would have assumed that he'd passed away, because one of the biggest issues with my job is that we don't follow up with patients. So there are issues with privacy, but there are too many to follow up on. And sometimes I don't want to know what happened. It's better that we get them to hospital and we don't know the outcome. I've done my job and I've passed them on, and I want to now go home and switch off from work. If we followed up on everyone, I'd never be able to switch off. So but part of the problem is then you don't know whether they've lived, died, improved, not. So to hear that he'd survived and was home was truly amazing. A highlight of my career. Yeah.
Well done. Well, I'm sure there's probably so many stories that you probably don't even know about.
Yeah, there's a lot. Oh, that's true. Yeah, there'd be a lot that I don't know about. So yeah, that's very true.
So you mentioned sort of, and look, I've unfortunately been in a couple of car accidents. I've been on the receiving end of not your specific work, but your colleagues here and overseas. And I think such a big part of your job is, like you're saying, bringing that calming factor. It's almost like you become like counselors.
Yes.
For that time. And I don't know, like in terms of, calming people down, what sort of training, or is just on the job your own natural empathy in that regard?
Yeah, look, I don't know whether they're offering it now, but certainly when I started, you learned it on the job. You learned it from watching your instructor deal with patients. You learned it from watching colleagues around you. And I think, part of, I think, being human is it comes naturally to want to comfort someone and reassure them. I mean, we're definitely told that reassurance is a huge part of what we do. And it's amazing how a patient's demeanor changes once you reassure them that they will be okay. Yeah. And that they're not having a heart attack, or they're not having a stroke, or they're not dying, and providing that reassurance. Yeah, you see physical changes. You see a heart rate reduce. You see blood pressure come down. You see patients breathing regulate. They stop sweating. So providing reassurance is a big part of what we do. And we are told, provide rest and reassurance, rest and reassurance. How we go about that differs from person to person. But definitely a big part of what we do.
So a lot of people want to understand, and I'm sure you probably were expecting this question, how closely do you work with Hatzolah?
Yeah.
Which area do you sort of work in?
Well, so the Caulfield ambulance branch is my home branch. So that's my base. However, because I'm part-time, I don't have a fixed home. So I'm rostered onto a different branch for every shift.
Wow.
But I predominantly work around Caulfield, Windsor, St Kilda area. Sometimes a little bit north up into Richmond or up into the city. But yeah, we work with Hatzolah all the time, very closely with them, and they're fantastic. I think the biggest issue we had with them in the beginning was they would always park right outside the front of the patient's house, and we'd get there in our ambulance and say, where do you want us to park? You've taken the driveway. And because they send 3 of them, and they're always there before us because they live, next door. So we'd get there and there'd be 3 cars parked and we'd have nowhere to park. So that was always, an issue. Can you move your cars? Can you let us get in? But they're fantastic. We work very closely with them. I mean, the question I get asked all the time by my non-Jewish colleagues is, why won't Hatzolah accept females into it? So I've got this ongoing discussion why. Even just last week, we were talking about it at work, and a lot of people think it's quite discriminatory or sexist that women aren't able to volunteer. But anyway, that's a whole other discussion, isn't it?
I think they are looking at that, because I know there are other Hatzolahs in other places in the world which have accepted female paramedics.
I've just heard that too as well. Yeah.
Certainly a question that they would be looking at, I'm sure.
but we have a very good relationship with them. And I mean, when you work in the Caulfield area, you get to know them well, but sometimes someone comes that normally works in, I don't know, Melton, and they end up at Caulfield for a day and they've never met any of them before. So they get to a job and there are, you know, 3 men with beards and kippot. And so I have to explain to my colleagues sometimes, it's the Jewish, you know, first responder program. Like, they're meant to be there and things like that. But yeah, we have a great relationship.
I mean, I'm assuming you would find it like, you know, obviously you guys have less resources to be there as quickly as they can because they're based in the area. So
Correct.
you find like they've assisted you when you get there, that like they've done a big part of the job for you? Or
definitely, they always, well, they get things like name, they get all the personal details, so names, addresses, collect the medication, and they've usually managed to do 1 set of vital signs. So they'll give us a heart rate, a blood pressure, respiratory rate, temperature. So they do the basics and then they hand over to us. They will then always offer to go and get our stretcher or grab a bag from the car or assist us with extricating the patient. So it's great. Sometimes all we need is an extra pair of hands, and they're always willing to help us. But yeah, they've usually done. They're always there before us. We always joke. So yeah.
So let's just talk a little bit. Time is running, and I think there's so many more questions that are coming to me privately.
Sure.
Just a little bit about COVID.
Yes.
And it was so interesting to hear about how it's changed the on the ground experience for paramedics.
Yes.
You feel like, and I know this is probably a hard question to answer, but do you feel that it's put the public at risk in some way, like, you know, putting COVID aside, because obviously you may not be on the way you usually used to treating patients, you know?
Yes. So there is a cohort of patients, those that suffer respiratory distress or shortness of breath, that we do manage differently, unfortunately, to the detriment of the patient. So we no longer use nebulizers on patients, for example, asthmatic patients. So we're not using nebulizers at the moment. So unfortunately, yes, it may negatively affect the patient. Ambulance Victoria has weighed up the pros and cons and decided that to do that and put ourselves at risk is a greater risk, I guess.
It's weighing the less of two evils, I guess, you know?
Yeah. So we've changed some of the things we have changed. I don't know the numbers and outcomes and whether there has been negative outcomes as a result of our change in practices. I know that people are they're more reluctant to call an ambulance, and so they're waiting longer with things like chest pain or shortness of breath, whereas they normally would call a bit earlier. People don't want to go to hospital unless absolutely necessary, so they don't want to expose themselves either to that environment. And they found that, people aren't seeking out medical care as early as they should be.
Yeah, it's hectic. And in terms of that, you mentioned about the heavy duty PPE equipment that you wear. So when you've like dropped off the patient's hospital and you've signed all the things you got to sign, because I'm sure there's all the paperwork.
Yes.
What's like the next step for you? Do you have to like desanitize yourselves or?
Yes. So we have to, we decontaminate ourselves. So piece by piece. So we will, the amount of hand sanitizer we're going through is just out of control. But so we sanitize the goggles we wear. So we reuse goggles. So they come off. Masks are disposable. Face shields are disposable. Gowns or overalls are all disposable. Boot covers are disposable. But we wipe all these things down as we remove them. So piece by piece, we decontaminate. We then take it off. Then we sanitize our hand. Then we take off the mask. Then we sanitize our hand. Then we take off the overalls. So it's bit by bit by bit. But we have to do the ambulance first. So we have to, we decontaminate the full ambulance first.
Sprays and all that, whatever.
Well, sprays and wipes and mops and, all decontaminating liquids and solutions.
That's a lot of extra work. A lot of extra.
That's it. It's a lot of extra work. And at 4 a.m, the last thing you want to be doing when you haven't, had a meal or you've been working already for 10 hours straight is to clean an ambulance from top to bottom. So people are exhausted. They are fatigued because of all that extra work that we're not used to doing. And so we're getting less downtime. So less time to just relax and close your eyes, and taking a toll on people.
Wow. Full on. And again, if people, and that's why I thought this talk would be so good, because people don't hear this, or that, some people might know paramedics, but most of us probably don't know a paramedic. So a couple more questions if we can.
Sure. Yeah, I'm in no rush, so it's fine.
Okay, so your show Paramedics, a lot of people really felt, like you said, for your kids was an eye opener. I think for so many people who watch the show, to get that access to see the actual. How did you feel? Like you did say it was a nice new challenge for you.
Yeah.
How scary was it knowing that you're on television and they watch you, and how edited was it?
Yeah, I was very mindful of the language I used and all, P's and Q's. But look, I'm a bit of an open book. So it was like, you get what you get. So this is the real me. And I didn't want to change my practices to kind of meet their criteria. They picked me for a reason. They obviously saw that I could bring something to the show. So I thought, I'm going to be true to myself and manage the patients as I would. And when we were doing the job, the cameraman would always stand back, and we wore GoPros on our chests. So a lot of it was footage from our chest cameras, but we were never interrupted during the job, and we were allowed to do it as we would normally. And we were very conscious though of doing everything properly and by the guideline. Not that we ever wouldn't, but just particularly mindful. And so, I just thought, look, this is who I am. You take it or you leave it, and you get what you get. So, and people seem to enjoy watching me. So whether they could.
Will you be on the next series?
The plan is to continue. So they were hoping to start filming again in November. At the moment, everything's up in the air, but they want to follow the story of each paramedic. So it's called Paramedics because it focused not just on the patients, but on us as people.
So you character development through
Exactly. So they wanted to do a backstory on everyone, and they wanted to know about me and my children, and balancing being a single mother and working shift work and being a paramedic. And so they were looking for that kind of information. And then the public want to know what happened. So they want to find out what would happen, and did she find love, and things like that. So it's amazing. I get recognized a lot when I'm in uniform, and I'll be somewhere and someone will come up to me and they'll go, "I know you." And I'm like, "No, like you don't." Like, you think you know me. But it's always like, they go, "I know you." And it's like, what you see on the TV. It's definitely edited because the production team have an angle, and they need to turn each job into a story. So we were told, look for the story within the story. So within the case, what's the story? Is it about, have they been married for 50 years, or are they a new parent, or what's the story there? And they wanted us to kind of dig a bit deeper and find out what was going on.
And they do, and you're probably amazed when you see, because I've been on some interviews, and they wanted to. They say we had a TV crew come and see us doing how we do Shabbat. Obviously, it wasn't on Shabbat, but it's amazing how they put it all together. It's just incredible, isn't it?
It is. And sometimes I watch and I go, oh, did I say that? Like, oh my goodness, do I sound like that? And I say things I don't even realize that I'm saying. But they edited it a little bit, but not too much, no.
Yeah. So a couple of I think a lot of people would be interested. How many Jewish paramedics that you know of? Like, is it a big professional Jewish?
No, I'm thinking off the top of my head. I probably know off the top of my head fewer than 10. I would say that I can think of. There may be more, but not many. Yeah, I can't think of more than 10 that I know off the top of my head. I think I've been in the longest amount of time. There's definitely more doing it now. When I started, no Jews worked as paramedics 17, 18 years ago. So it was unheard of to do that. Whereas now it's becoming a lot more popular, and more are taking interest in it. And I've given some, talks for a career day at school, and kids really are fascinated by the job and interested in pursuing it.
I'm sure. So I was in a few months ago. We were just in between lockdowns. We went on a boating thing, and I heard a big rip in my shoulder. Anyway, paramedics came and they gave me this thing called the green whistle.
Oh yes.
How did we get some of those?
Yeah. You and me both, huh? So I have actually had it once. I broke my arm really badly at all places. The place that we always say don't go to is Bounce, because every week someone's injured at Bounce. So of course I took my 3 kids to Bounce, and I thought I'm a ninja warrior. I can climb walls, and I guess what goes up must come down as well. And I fell off a wall 3 meters up and broke my arm really badly. And they called me an ambulance because I couldn't get out, and I had the green whistle too. And I remember what was funny was you lose your inhibitions when you use the green whistle. It's almost like being a little bit drunk, and you become quite chatty and everything's funny. And I had this internal battle going on in my head between, you're amongst colleagues and be cool and be professional, but then wanting to enjoy this little party going on in my head, and I'm like, which way do I go with it? So I don't remember much of the trip to hospital, I must say. So it obviously worked well, but it's a very, very effective drug, very good drug.
Yeah, it definitely was. So two last questions. I know with Victoria Police, it's very much you feel like you're part of the family if you're in that space. Is that sort of similar with the paramedics?
Very much so. We really are one big family, and everyone looks out for each other. You watch out for your colleagues, you help them out, you take over jobs if they're due to finish. It definitely has that family feel. Yeah. I think for me, what I miss being part-time and not having a fixed home is that I do miss out on that branch environment where everyone knows each other, and it is really one family. So I would at some point like to end up working back at the Caulfield branch, because I do know all the paramedics there, and you do feel like you're at home there. So whenever I'm rostered there, it's great. So I'm hoping to one day get back there, but at the moment I need to work my set days so as to accommodate more homeschooling now, but kids and work. But it is where everyone looks out for each other. Yeah, definitely.
Well, look, a big call out to you and to all your colleagues. I mean, and thank you for sharing such incredible insights. We could probably ask you questions all night, but obviously, with the interest of time, we're going to thank you for that. And just stay safe in your role, and thank you for putting your life on the line and risking yourself every time you respond to a call.
Like you say, it's a job for me at the end of the day. It is a job, and there are so many others out there also doing it, putting themselves on the front line. So
thank you. And I guess just to end, is there anything you would ask of the public at this time? Now's your chance.
Oh, that's a good question. I'm not used to not used to. I think what I do want to reiterate is, you mentioned something before that sometimes you're a therapist. Like sometimes we act as a mobile social worker. So what I classify as an emergency will differ to what someone else deems to be an emergency. So don't ever feel like you can't call us. We often get patients apologizing. I didn't want to call, I'm sorry for bothering you. Don't ever apologize. This is my job. This is my passion. And if it's a crisis for you, if it's an emergency for you, then I'm happy to come and assist you. And don't ever feel like you're inconveniencing us by calling, especially now, even during COVID. If you're not well, if there's a problem, pick up the phone. We work 24 hours a day. 4 o'clock in the morning is not the greatest time, so you might not. I might not be happy, but
you'll be there.
We'll,
I love that. I love when I asked you what you want from the public, that you were telling them not to feel bad to call you. So that just
yeah.
continues to demonstrate what type of people and person you are. So I want to wish you, on behalf of all of us, a Shana Tova Mitzukah, and
Thank you, Rabbi. Thank you.
you've got a
Too.
much more peaceful and easier year ahead for all of us. And if I could just pitch my tomorrow night, if you wanted to learn about Yom Kippur, myself together with a colleague in Sydney, Rabbi Yossi Friedman from Maruba Road, we did a talk last Thursday night about having Rosh Hashanah at home, and this week, tomorrow night at 8 o'clock, we'll be having Yom Kippur at home. How do you find meaning in that? You know, because a lot of people, most of the community is used to going to shul, a lot of the community, and badly looks like we might be at home. But anyway, thank you for joining us. Thank you for your time.
Okay,
we really appreciate it. And yeah, hopefully we won't see you in your professional role.
That's right.
Unless somebody's having a baby, please God. Otherwise, we look forward to just talking to you and to seeing you in casual times, you know.
Definitely. Well, thank you, Rabbi, for inviting me, and I've enjoyed it. Thank you.
Absolutely. Thank you. We've enjoyed it too.